Stacey Roberts, welcome to the Aging Fiercely podcast. I'm very excited for this conversation. Just to name a couple of the things that you do, you are a best-selling author, you're a physical therapist, a registered nurse, a functional medicine specialist, you have over 30 years experience. I mean, I just want to dive into so much. So you tell me where you want to start.
Oh, thank you so much, Anne Marie, for having me. And I
Yes.
love the title of this podcast because it's what I believe we should all be doing, right? So
Yes.
I think it's fantastic. And thank you for the opportunity to be here and talk about how we can both help people.
Yeah. Oh my God, I'm totally here for this.
Right.
So you have a book called The Pain-Free Formula. I think this is such an amazing topic because I feel like there's so much chronic pain that occurs, a little bit later in life, sometimes not. People of all ages deal with chronic pain. So I love the idea of first dealing with it on a holistic level. Can you kind of give some insight as to where you start with people when they come to you with some sort of chronic pain or
Sure. So the majority of people that come to me now are dealing with some sort of musculoskeletal pain that probably has been going on for a long time. I would say that majority are women, probably perimenopause and older, but we still do see teenagers and
Mhm.
men and many people because as you said, there's really no age range
Yeah.
that's you're limited to experience chronic pain, right? So from the first step of what we do, if you're coming in for muscle and joint pain, for example, is we take a look at how you move, right? We take a look at where potentially the trigger is and why your body potentially has not already healed this, right? Because we have an
Hmm.
amazing healing aspect in our body. If we scratch our hand and it gets red and puffy, as long as we stop scratching it, the body takes care of it. A couple days later, we don't really see the redness or puffiness anymore. Then it's in anti-inflammatory phase. Then it heals itself without us having to do anything.
Right.
So when someone has chronic pain, the question is, why is the body doing what it would normally do, right? Especially if
Hmm.
you're generally healthy. So we really take a look at that. And sometimes it's movement. Sometimes you've had an injury in the past and maybe you're going through menopause now, or maybe not eating the best diet, so you've got general inflammation, and then that exacerbates the inflammation surrounding that injury. Whether that's acute, meaning it just happened, or subacute, meaning it's kind of happened a few weeks to a few months ago, or whether it's chronic for a longer period of time that you've
Hmm.
had it. So we watch how you move to see, are you triggering it? Like if I kept scratching that scratch, then I'm continuing to trigger it, right? So how are you potentially triggering it by the way that you're moving? And we help the patient correct that while we're also using a technique called soft wave therapy,
Hmm.
which helps to decrease inflammation locally in that joint or muscle, and then helps accelerate their healing process. If after 3 or 4 visits of that, we're not getting at least 50% better, then we start branching out and looking at what else could be contributing to this, right? So if you and I were talking, I'm not sure how old you were, but I would, ask you how old you were and do you still menstruate and, just to get an idea of where you are in that transition. And then we would potentially focus on hormones a little bit more, depending on your age. Or if you said, I have gut issues or I have skin issues or I'm tired and fatigued all the time,
Hmm.
I then might look at, okay, what are we putting in our body? Especially if some nights it happens that it aches, some nights it doesn't. What
Hmm.
might you be eating that could be contributing? And then
Oh.
we go down that path potentially. And we also look at your medications. Are any medications contributing to
Hmm.
issues with pain? So we really take that, like you said in the beginning, holistic view and really meet the person where they're at. And everybody doesn't get the same recommendations because
Right.
everybody's so different.
Yeah, no, I love that. So what brought you to this work? Like,
Well,
looking at the body as a whole, which you don't normally get when you go visit your doctor. It's
mhm,
more very narrow, like this part is this part and this part is
mhm.
this part, and they don't come together.
Yeah, very compartmentalized for sure. The
Yes.
conventional medicine is, and really it's grown into a bajillion-dollar industry by doing that, right?
Yeah.
So how I came about it is I would say I would have been pretty much biomechanics, looking at musculoskeletal system pretty much exclusively when I first got out of school. I was in sports medicine, we kind of getting athletes back to play. And but then there were patients that weren't getting better. And I was like, well, why? They're doing everything they're supposed to be doing, or they're telling me they are. It's
Right.
so easy to be like, they must not be doing their exercises, or they must not be following what I'm saying.
Yeah.
But really, the ones that I knew that were doing it weren't getting better. So I started to get curious. Why is that? I mean, if I'm doing everything that I can to help them, they're doing everything they can do to help themselves. It's got to
Right.
be some other reason. So that led me down a lot of different pathways over the years of, how does the brain work with pain, right? That was the first place that I went.
Ooh.
Then it was, I started experiencing pain that was kind of unexplainable to me. I found that I had certain food sensitivities that were contributing to that. I would have never, ever, ever put those things together.
Oh,
And I
interesting.
started, then I went into perimenopause and I started having, well, I actually had a pretty good menopause,
Yeah.
but I'll say post-menopause, I started getting this pain that I was like, where is this coming from? And I wasn't able to control it by my normal PT stuff. So I started looking at hormones. So then realizing that everything or all those things connect. We can't really separate them, but we can prioritize how we address the
Ooh.
body based on how the patient is presenting.
Okay. Okay. So you noticed food sensitivities,
Hmm. Yep.
and that helped, or that you connected to pain in the body.
Yes. And it was interesting because that was a huge disconnect for me. Like I never would
Right.
have thought that. We weren't kind of raised to think that, or I wasn't trained to think that. So one time I had a patient who I was talking to her and I said, she wasn't seeing me at that time for pain. I was helping her with optimizing hormone balance. But I thought during the interview, I thought, you know what? Have you ever been tested for celiac disease? And she said no. So she went and got tested, and sure enough, she had celiac disease. They did the endoscopy. They saw the damage in the small bowel and intestine. And once she got rid of gluten, so many things changed for her. But one
Mhm.
thing that really jumped out to me was her joint pain went away. And I was like, what?
Oh,
I was
yeah.
like, that's interesting. So
Yeah.
how does that work? Right. And that was kind of before the microbiome and stuff was really looked at. So I just knew that there was this connection. And subsequently, I had some back pain and I had some other pain that would come and go. And I'd be coaching my son and, I'd be standing there and I'd get shooting pain into my leg and into my foot would kind of curl up. So I had an
Hmm.
MRI and I had three bulging discs, not surprising after,
Right.
decades of athletics and stuff like that. They never really bothered me because I could always control it, but it got to the point where I couldn't. So I thought, I don't know, I'm just going to give this gluten thing a try, getting rid of it. And sure enough, that pain went away. And I
Huh.
was like, exactly. That's how I was. I was like,
Right.
huh. And even to this day, I don't have that same pain down my leg
Really?
into my foot. But if I do have gluten, if I see a croissant, Anne Marie, then I'm like, dang it, that looks so
Huh.
good. And I do it. I'm always very hopeful that I will not experience it. And I don't
Yeah.
experience it to the degree that I typically would have. But I do typically somehow, it's whether my skin changes or I get itchy or I notice that I have a little eczema in one area or that back pain and leg pain happens. So I know it's a direct correlation for me, even causation for me and pain. Not everybody has to get rid of gluten. That's me
Right.
personally, but
Right.
everybody's different. For you, it might be, I don't know, white potato, might be dairy, it might be.
Right.
That's why we do the food sensitivity testing to see.
Wow. Because that's kind of blowing my mind a little bit, because I always understood that the gut biome is extremely important. It's like our second brain. Like
Hmm.
I totally understand that a lot of our immune deficiencies, or when things go wrong, always look to the gut, and have your prebiotics, your probiotics. Like, I know all like the top line rules, but when it comes to like chronic pain, I would think that the body is doing one thing while the gut is doing another. And again, maybe that's just me not connecting the dots.
Right.
But
It's
like I do have chronic pain, and I'm like, so now wait a minute, because it
hmm
doesn't, I attribute it to like always holding my babies on one hip, right?
hmm
So I just felt like there was like a muscular imbalance.
hmm And there could be, right? So that could be part of it, right? You could be triggering it in some way. But if how long has it been since you held the babies on your hip?
Oh, it's been a long time.
Yeah, years. Has it been years?
It's been
Yeah.
years, and it's years that I've had the pain.
Yeah.
So,
So that's where we would go. If you were seeing me, I'd say, okay, you're no longer doing that
right,
potential aggravating factor. So why isn't your body doing what it's supposed to do and helping you get rid of that? So then we look globally, we look bigger. Now, am I going to still look at your posture and am I going to still test your
right.
strength and flexibility? 100%. Because
Yeah.
again, it's all part of the picture. But my inkling for you then would be, okay, let's dig a little bit more into, what you're eating. And there's certain food
Mm.
sensitivities I don't recommend, food sensitivity tests I don't recommend because research has shown them not to be as accurate. And those are called I as in Idaho, G as in Georgia, G as in Georgia. IgG tests tend not to be as accurate. So I use something called the LCAT, ALCAT, which I've used for over 20 years, and it's really helped myself and a lot of my patients. And there's another
Oh,
one called an MRT. So that's where we would probably go with you, but I'd also consider hormones as well too, based on, your age range and things like
right,
that. So that's what would clue me into. If you're no longer doing the thing that you think was the problem and
right.
the pain is still hanging around, there's usually something else. And the other thing that I realized when I was researching my book, The Pain-Free Formula, is I was looking at the gut joint axis and I knew there was a gut brain axis. But then as I'm reading, there's like a gut lung axis, there's a gut liver axis, there's a gut,
Huh,
pretty much everything axis,
right.
right?
Yeah,
The vaginal microbiome, pretty much everything has a microbiome. So we separate it out again into these axes like there's something separate, but they really
right.
all work together.
Yeah, it's just one big system. That's
Mhm.
so, I don't know, that's fascinating. And then also to think about the brain science behind everything as well, because I'd
Yeah,
imagine that's a huge
that's
part.
fascinating. That's fascinating. And as a physical therapist, when you more specialize in chronic pain, that's a path that you go down to try to understand what the brain is doing is not a bad thing. It's trying to protect us, but it makes us more hypersensitive to pain, right? So if we experience pain over and over and over again, our body is kind of on high alert. I don't want you to get hurt. So I'm going to, you're going to feel pain a little bit worse. So I'm protecting you. But when that no longer serves us, that can become a problem, right? Because then we're
Mhm.
afraid to do anything. And also, if we have gotten into the habit of taking things like NSAIDs or other medications over time to address the pain, because marketing is very powerful and we've been
Yeah.
very conditioned to look for that quick fix.
Yes.
Those actually also increase hypersensitivity in the body in regards to pain. So the longer you take those, the more you hurt. So, and the slower you heal. So I think most people, if they knew that, they wouldn't be popping the pills as often as they do, and certainly not giving them to their kids at every, I've got this ache or headache type situation either.
Right. Oh, shoot. Yeah, guilty of that.
Right.
I'm like, here's some Motrin.
Yeah, I have a funny story about that. I used to live in Australia, and we had my one of my son's friends come over, and he didn't he used to eating a lot of sugar all day, and he didn't really have that much sugar at our house. We just didn't have all the same stuff that he had, and he
Mhm.
had a headache, and he asked my son, and he goes, "Do you guys have some Motrin?" Or I think it's called Motrin in Australia too. I can't remember. And my son asked me, and I said, no, we don't have any of that in the house. And he goes, he was like 9 years old. He goes, who doesn't have Motrin in their house, And it was so funny. We were laughing so hard, but really that's the big reality is
Yeah.
it's like a household staple, right?
Oh, yeah.
And it that's where we've been conditioned through marketing and, pop this pill to get rid of the
Totally.
pain as quick as possible. Yeah.
Yeah, and like I know in the back of my mind, I'm like, this isn't the best thing to be doing, and especially like, but you call your pediatrician, and your pediatrician is like, yes, give them Motrin, and then if they have a fever, give them Motrin, and then back it with Tylenol, and then
hmm
Motrin again, and then Tylenol again until it comes out. So
hmm
you're just like pumping this into your kids, and yeah, I know it's like that quick fix.
Yeah,
It's like,
yeah, and don't feel guilty because I mean everybody does it. Everybody's told to do that, right? But it's when you start to realize the effects that that could be having, that then you just sit back and go, okay, when I know better, I'm gonna do better, right? I'm gonna make
right.
different decisions. It doesn't mean that I never take Advil or anything like that. I've probably taken it twice in maybe 3 years, but
Mhm.
I mean, it doesn't mean that I'm opposed, like, oh my God, you're
Right.
gonna die. But I
Right.
think it's something that we overuse, and we overuse it to our detriment because it
Yeah.
can impact how we heal and how we perceive pain as well.
Yeah, because the body really is an amazing entity. I mean, the whole
Yeah.
thing. This it
Hmm.
just your body knows and your body definitely speaks to you.
Hmm.
But that's why I do try to, when I do have like the pain, I'm like, okay, what's going on? What am I doing? How did I aggravate it? It's usually after a workout or, things like that. But like I do pay attention to like what did I do
Sure.
and just try to like tune in because
Yeah.
the body is just like a wealth of information and it can heal itself
Yeah. And it's talking to us all the time,
all the
right?
time.
Whether it's, I
Yes.
think Oprah says, talks to us in whispers. If we don't listen, it's
Yeah.
like pebbles, and then it's like a big brick against our forehead, right?
Yes.
So if we don't pay attention, but if we're covering that up, a friend of mine, Jack Canfield, who's author of Chicken Soup for the Soul, he
Oh,
said
yeah.
so great. He's like,
Wait, he's your friend?
yeah, I've known him for a
That's
while now.
amazing.
He's fantastic. I mean,
Yeah.
we're not buddy buddy, but
Right,
he's
but
helped me a
that's
lot over the years.
oh,
Um, and he said it's like taking the batteries out of your smoke detector, right? So
mm,
the fire is still there. We're just pretending it's not, right? But it's still gonna catch up to you
yeah.
at some point in time. So if we turn off that messaging, which we do sometimes with medications, and then that can become a problem, and literally could get and figuratively get burned, right? And by
Yeah.
doing that.
Yeah. So what kind of like is your typical approach then when somebody comes to you? I'm sure you see all sorts of different types of ailments, coming to you. Like, I don't know, like what is like the best approach to starting to figure out what's going on with somebody? Because there's so much. Like, what about the stress that they're going through, their jobs, how they feel about themselves, their relationship? Like I feel like a lot of that impacts your body.
Hmm. I think all of it does.
Yeah.
So it's really about getting with somebody who can sit across the table from you and ask you questions and understand where you are from a physiological point of view based on your age and your activity level and all that type of stuff, what you're going through. And really seeing, okay, if you are coming to me and you're 30 and generally healthy, and you're having all this pain that's not going away, but you're the CEO of a Fortune 500 company and you can't put your phone down during our
Mhm.
talk and you can't do all this other stuff, then, I'm going to look at managing stress first, right? So that's going to be a big part of it, along with the musculoskeletal stuff, right? Because that's always something you want to look
Right.
at to see if there's anything triggering it. If you are a 52-year-old, you've experienced hot flashes forever, you started playing pickleball with your friends, and your right shoulder hurt. I treat you for that. It gets better, but then your left shoulder hurts and your left foot hurts, and you're not even left-handed. Then I'm starting to think, okay, what's going on there? Is it more hormonal? But honestly, if we would all start with our gut, we would
Mm,
probably get a lot further, a lot faster,
right.
and then treat those other things on the outside of that too as well. But really, you could start anywhere and feel better. The thing that I just worry about is, if you have pain and it's hormonal, that you jump on HRT right away, which is I love HRT. I do it myself, but it's a matter of, is that the first line that you should do? Because if your diet's not right, if you're not dialed in, and you don't have to be
Mhm.
perfect, but if you haven't minimized your inflammatory foods or figured out what your food sensitivities are, you'll usually feel better right away on those hormones. But then some of the things will come creeping back in because you haven't addressed the inflammatory stuff that really is the catalyst. So
Right.
what do you do? It's, needing to find somebody to sit down with. Well, you could buy my book and see how that goes. But because
100%.
I really lay it out, I try to lay it out there for this exact purpose that people can go to their practitioners and be like, what about this? And what do you think of
Yeah.
that? Right. So that's kind of a roadmap. But overall, you want to have a good relationship with somebody who thinks more holistically
Yeah.
and can, try to help you from that objective point of view.
Yeah, no, it would make such a bigger difference, I feel, if we all had access to someone who was, coming from it the way you do. when we go to our general practitioner for our yearly physical, it's like doom, doom, doom. It's just like, I don't know, you don't get those questions
Mhm.
that kind of look at you on the whole,
Right.
which is so unfortunate. So it's like someone like you is like a blessing because you're looking at them in a completely different way.
And it's not their fault. They only get like 10
Right.
to 12 minutes with people. You can't
Yeah.
really engage in a, I mean, that I barely found out what the person did over the weekend after, 10 minutes, right? So,
Yeah.
and building that rapport with somebody. So I get it. It's a problem in our conventional medical system. And then you've got to pay out of pocket for people that spend more time with you. Like we spend up, 30 minutes, 45 minutes, an hour with people.
Yeah.
So
Wow.
it's harder for the average person to be able to do that and pay cash. But you find that if you don't, you really can pay for it over time.
Yeah, no, exactly. I've definitely put a lot of money into acupuncture uh, as a way to help treat, some of my chronic pain, which has
Love it.
definitely helped.
Love
Yeah.
acupuncture.
Uh,
It's great. I think it just helps again settle that nervous system and so many things that it does that's out of my purview in regards to the meridians, but it's fascinating. It's been working for people for centuries.
yeah,
And I
exactly.
just think too, along with that, let's look at the trigger. So why you're having it. So it doesn't become something that you feel that's the only thing that can help you. I
Right.
want to empower my patients to be able to say, um, I don't need to see Stacey every week for the rest of my life. Um, I can manage this if it happens in the short term. If it gets out of my control, yeah, I'm going to call her up. But
Mhm.
I know how to manage it in the short term, and then it should go away, right? Because we're optimizing the body's natural healing process, and if
Right.
it doesn't, then coming back and let's talk and let's regroup and let's see where we're at.
Right. Right. And you also mentioned, was it soft wave
Soft wave
therapy?
therapy is a type of shockwave therapy.
Okay. How does that work?
Great question. I asked that same question like 5 or 6 years ago because I'd never heard of it. Never
Yeah.
heard of it. A friend of mine came to me who I've known for over 40 years and I've treated pretty much every part of her body, pretty much. Um, and she came to me and said, "Hey, I saw this thing called soft wave and I was wanting to get your opinion." And because I treated her for her shoulder pain. She had something called calcific tendonitis, which is little calcium deposits in her bicep tendon. And we got her to where she was pain free as far as motion goes, except if she slept wrong or, with
Uh-huh.
pickleball, went way behind her head to get something from pickleball or tennis or whatever she was doing. So she wanted to get rid of that. So I was kind of like, well, you know what? 90% of the time you're good. Do you really want to spend money on this? So it's exactly what my patients typically think now. So she dragged me to this demo that this guy who was about an hour and a half away, he kindly came to our area to show her how it works. He was a friend of a friend. And I was so skeptical. I write about it in my book, and I was sitting there with my, arms crossed, and I was really there for the dip and the chips and the lunch, right? Because I was like, there's no way that this thing works. But when he put it on her shoulder, one thing you have to remember what I just said is that she didn't have pain until she moved it into a
Hmm.
certain position. Now her arm's at her side. He had no idea, and we didn't give him any information. He had no idea that there was this specific diagnosis of calcific tendonitis. When he went over that area where I knew the calcium deposit was, my patient goes, "Oh," or my friend, I should say, goes, "Oh, that that's it. That's the pain. That's the spot." And I
Okay.
went, "Huh, that's interesting." She wasn't moving. She wasn't, doing so. Somehow that wave created a situation where the body recognized, oh, this is an area that's inflamed. Then when that wave goes in, it talks to the body, right? So then the brain goes, huh, what's going on down there? So then it sends stuff to that area to try to fix it, right? To initiate the healing process. And I am still, 6 years later, blown away at how quickly it accelerates people's healing.
Oh.
I used to treat, let's say, plantar fasciitis, right?
Mhm.
I think after 35 plus years as a PT, I'm okay. I'm pretty good at what I do, right? So it would usually take about 10 to 12 treatments, and people would most times, if they, follow through, would be back to what they would typically be doing.
Uh-huh.
And this cuts that in half. Like it can be 3 to 5 visits, 3 to 6 visits, and they're back
What?
to doing. So it just enhances what I can do in the clinic manually with my hands and with exercise and movement patterns.
Right.
It really just allows us to get the patient there faster, which is nicer too, because they're not paying out of pocket for 12 treatments. They're getting better in three to
Right.
six, right? So
Wow.
it fascinates me. It really does well in any musculoskeletal pain. So I'll there, and if your listeners want to know where they can find a soft wave provider,
I want to know.
okay, I'll give you. There's a website, softwave T as in Tom, R as in Robert, T as in Tom.com, softwavetrt.com/providers, or you can click on provider search at the top, put in your zip
Okay.
code, and see who's in your area.
Wow. So this is really some powerful tool then.
It's one of the most powerful tools I've seen in 35 years. And I never used any modalities. I didn't use any other types of machines. That's why I was so skeptical when I
Yeah.
heard about this, because every other device that had the promise of doing XYZ never really moved the needle for me. Not more than what I could already do with my hands and with my physical therapy background and the coaching and stuff that I did. But
Wow.
this is the soft wave is something that if you would have told me 6 years ago that I would be a principal investigator in a research study on a modality called soft wave, I would
Right.
have been like, what are you smoking? Because there's no way would ever think I would do that. But now I'm into research on it, help other providers. And I
Wow.
just want as many people to experience it as possible because it can
No,
really
that
be a
sounds
game
like
changer.
amazing. So what exactly is going on then? Like, is it sending sort of like sound waves or
Yep. So shockwave happens in nature, like volcanic eruptions, explosions, things like that, create shockwaves. And this shockwave, once it goes into the body, turns into an acoustic wave or a sound wave. So if
huh?
you're standing on the beach and the waves are going back and forth and hitting your legs, that's like the shockwave hitting the cells in the body. When it does that, it makes the cells contract and expand. And some other modalities do that too, but not to the extent that shockwave does. So when they contract and expand, those cells become what's called permeable, meaning their cell membranes, the thing that keeps them intact, kind of opens up a little bit and releases factors that will go to the area that's being stimulated, as if there is a worry of an injury, or it's trying to say, oh, I've got to heal this area, right?
Okay.
So it's kind of like the body when you get into chronic pain, the body can kind of compartmentalize that area and not really pay as much attention to it. If there's inflammation there, sometimes there isn't even with chronic pain. But if there is, this is a great way to localize that inflammation, get more of your body's attention to it so it can kind of restart that healing process. Because most people, if they have inflammation with chronic pain, they're stuck in this pro-inflammatory phase. That's the phase where it hurts more. So we want to move them into an anti-inflammatory phase, and that's what this
Right.
does. It modulates that inflammation because once they can get to that anti-inflammatory phase, it's a lot easier for the body tissues to heal.
Oh, wow. So, and you're saying that like 3 to 6 treatments, how long does a treatment last
Typically,
typically?
well, my treatments will last anywhere between a half an hour and 45 minutes. If it's soft wave only, it's anywhere between 10 and 15 minutes. So it's a fast treatment. I have people who graduate and finish their care plans, feel good, but still are active. So they want to come back maybe once a month to kind of, check it out, see if there's still an issue. That's when I go train some professional uh, teams, like I've trained the New York Yankees and the Boston Red Sox and some other professional teams
Ooh.
on how to utilize it. We also do prevention. So, if you're an athlete and, you want to get through your season, hopefully without an injury, we might treat your shoulder to see if anything pops up, if there's any inflammation in there. And if it is, then I can give you exercises to prevent a problem from happening.
Wow.
So we use it for prevention as well as treatment too.
That's amazing. That
Mhm.
sounds incredible. So you're saying there are providers like across the country, like
Across the country. I
I'm
think
checking
there's,
for,
yep, yep.
'cause
You,
I
you
will
let me
be.
know. You let me know who it is, and I'll give you the thumbs up. But yeah, I
Oh,
think
really?
there's like 1,500 to 1,700, something like that, providers around the country.
Oh my God, that sounds incredible.
Yeah, it
Like,
really. I encourage everyone to at least try it, right? And you should notice a difference in that first treatment. Now, it's
wow.
not going to magically stay that way. Although my friend who had the issue with her shoulder, it didn't she had no pain after the treatment, and that lasted for 2 years. So it's very
Wow.
rare. I've only had that happen, a handful of times in 6 years. So it's not what
Right.
we expect.
Right.
But at least in that first treatment, the pain should go down in that treatment. You should walk out feeling at least 50% better, if not zero pain after the first treatment. And then, the body is still trying to heal. And so
Yeah.
it might come back within a few days. But then each time you go, it should get longer and longer as far as the relief goes.
Yeah. And then do you pair that with like the PT exercises and
Yeah, I do more hands-on work in that body movement, getting the person moving better, and then we complement that with a few exercises. I don't believe in giving this, 20 exercises to somebody. I believe in giving, 3 or 4 of really focused
yeah.
exercises, and then hopefully they're also doing their own workout program. If not, then I connect them with one of my colleagues that can set up a workout program for them and incorporate some of this into it.
Yeah. So you recommend doing that kind of like as part of
I do. There are
another thing.
many. Correct. There are many clinics out there that don't. They just do the soft wave, and that's okay because it can help people get better. But my belief system, being a PT for as long as I have been, is if
Hmm.
we don't get rid of that trigger, we don't take care of that movement that continues to trigger it. Is it going to come back? Is it more likely to come back? Or are they more likely to get injured again? So, I'm I'm of that belief system. So I typically don't do soft wave only from the start, but I will
Hmm.
certainly do it after they finish their care plan because then we're maintaining what we've gained and they're also moving better and
Yeah.
healthier and are much less likely to re-injure.
Right. Because then you're looking at the way they're walking, the way
Hmm.
they move their bodies, the way
Right.
they sit down, stand up. Like I'm just,
Yep.
you're
Like
looking
if you
at
had like if you came to me when you had little ones, I'd be like, okay, show me how you carry them. Right. And you'd show me that was on the hip. Right. Exactly. And I'd be like, okay, well, let's move from hip to hip, or let's try doing this, or, so we look at, different ways. If you're a runner and you always run on the right side of the street and then you cross the street and then you go on the other side of the street, you're always on a slant. Your
Oh,
right foot is always on a slant down. So then we might
interesting.
say, okay, instead of running that way, change it to the same side of the street or on the sidewalk or whatever it is. So we assess, see what that person's doing, assess how we can adjust it so it's not so much wear and tear or stress on the body.
Yeah, no, I find that fascinating because we just do things we don't even realize it. Like looking at your body in the mirror, like I've definitely noticed like,
Hmm.
things aren't lined up the way they used to
Yeah.
be.
Yeah, and sometimes I tell people is look, there's so many people walking down the street that I'm like, here's my card. You're gonna need me later. But they're not in any pain, right? So just because you're not perfectly straight and you don't have your spine maybe
Yeah,
curved slightly, or you might not be able to straighten your knee totally for whatever reason, doesn't mean that, oh my God, you're gonna fall apart, right?
right.
That's where the hormone stuff comes in. That's where the gut health stuff. Like I said, I have 3 bulging discs. I mean, I haven't had an MRI in 20 years, but I would imagine they're still there, right?
Right.
But I don't have pain if I don't do the things that trigger it. I have, had a knee injury that I talk about in my book as well at a wedding. Weddings can be dangerous for those over 50. Um, and, Softwave really helped me with that. And I don't have pain in that anymore.
Oh
Like,
my
even
God.
though the doctor showed me your knee is full of arthritis, you need a knee replacement. And I'm like, what are you talking
Oh,
about?
stop.
Yeah, and that was a big light bulb moment for me when I was with the doctor and she showed me the x-ray and she said, you need a knee replacement. And I'm like, what? It didn't hurt before the polka incident at the wedding. So I'm like, I'm
Oh
not getting a
God.
knee replacement. But then I thought to myself, that arthritis didn't just happen like at the
Right.
wedding, right? It's
Right.
been building for probably more than a decade. So I didn't have any pain. So you don't have to
Wow.
have pain just because you have arthritis.
And then did you do anything about the arthritis or no? You just did the
Just did my
shockwave,
soft wave. Yep, just
soft
did
wave.
soft wave, which is shockwave. Did that, and then first after the wedding incident, I really literally couldn't put my foot down. It was searing pain. Something popped in my knee, and it swelled up like
Whoa.
crazy. And it was funny and not funny at the same time as I tried to drag myself off the dance floor and then to my car.
Oh my
But
gosh.
But it was such a good learning experience for me because it just opened me up to understanding my body, but also then being able to help me help others with the same issue. And because
Hmm.
we automatically think if it's arthritic, I need surgery or I'm not getting
Right.
better or that type of thing. And that's not necessarily true.
Wow, that's
Mhm.
incredible. Wow. Wow. All right, good for you.
Thank you. Yeah.
Um, Speaking of like types of therapies, do you use red light therapy at all? I know that's like a big trending,
Yep.
and
We
it's
have red
proven.
light therapy mat, a small mat, and I think it's okay. But when it was one of those things also when I used before, it didn't really move the needle. It might make them feel good while they're doing it or shortly
Okay.
after. But I'd have practitioners that use soft wave and red light, and they also feel like that combination helps people feel better faster too.
Okay.
So
Okay.
I don't use it a lot in my clinic. I use it in certain cases, especially if the issue is more superficial and I feel like I need more blood flow to the superficial tissues, along with soft wave increasing blood flow to superficial and deep tissues. So I might use it then.
Okay.
But you're right, it is a trend. There's so many people, and shockwave, to be honest, is a trend too, but one that I think is going to stick because of its outcomes. But I think using them together is really a really good option.
Yeah. Yeah. I had a question. Shoot, what was it? Because your book is about, oh, I want to talk about hormones
Mm,
and menopause and perimenopause. And the I don't know if I'm right or wrong in this. To get your hormones checked, doesn't the like don't those levels change often that it's really
mhm.
hard to gauge
Yeah.
what so what do you do? Like how do you know?
Especially in perimenopause, right? So
Yeah.
if you are in perimenopause, your hormones can shift from one day to the next. So
Yeah.
what I like to do, especially blood tests, right?
Hmm.
So what I like to do is get something called the urinary metabolites test. Now, this goes against the conventional medicine way of looking at things is, okay, the hormones that jump up and down so much. So we're not going to test. We're just going to give you this based on your symptoms, which
Yeah.
is kind of funny because for decades they've been like, how can you give supplements and herbs just because of symptoms without doing any testing? But now they're all of a sudden like, oh yeah, we don't need to do testing. We're
Right.
good with just the symptoms. Um,
Interesting.
the problem with that is the symptoms don't tell the whole story. So if you don't have data to back it up, the blood tests are tricky. If you're
Hmm.
still menstruating, you want to try to see if you're still ovulating and then kind of get the blood tests on certain days to give you an idea. For example, if you're still menstruating, you're perimenopausal, and you know that you've ovulated, then I would recommend 7 days after ovulation to get a good balance of your estrogen progesterone. Still not the most reliable. But what I want to know more in perimenopause and menopause is how are we managing those? How are we metabolizing those hormones? How is our body using them? So we do what's called the urinary metabolites test, where you either through Dutch test, you take dried urine and send it in. You take a couple samples and send it in, or another company called Physicians Lab has one where you also do 4 urine samples and then throughout the day and then send those in. That tells me how my body is utilizing the estrogen that I am making or the progesterone that I am making. And would there be some variation? Yeah, probably. But because they're metabolites, it's not going to be as huge of a variation as just measuring that one specific hormone. And what a metabolite is, Anne Marie, is if I had a house that I would call a house made of Legos, I would call estrogen. Each of those Legos would be a metabolite. So it's how
Okay.
the body breaks that hormone down to either get rid of what it doesn't need or to reuse what it wants.
Hmm.
So there are certain metabolites that tend to be associated with inflammation and maybe cancers or maybe things that we obviously don't want to happen to ourselves. And there's other that are protective. So I want to see that measurement because here's what can happen. If you have hot flashes, you can get estrogen because of the hot flashes. But if it's not tested in a couple different ways before, your estrogen could actually be fine, but it might be low progesterone. That's the
Hmm.
issue. So then you're given estrogen on top of estrogen that you're already making. Now, if your estrogen was kind of on its way down, that might not be a big deal. But if your estrogen was still relatively okay, you're stacking more estrogen onto that. That too much estrogen can create inflammation. Just
Hmm.
like too low of estrogen, we don't have estrogen and progesterone and testosterone. They're anti-inflammatory for our bodies. So when they get too low, we lose some of that anti-inflammatory protection. So, but too high is not good either. So then people go on estrogen like, oh, I feel horrible on it, right? Or somebody goes on progesterone, but their body doesn't metabolize progesterone well, or maybe they have a genetic predisposition to having issues with converting something like progesterone into more of a calming substance called GABA, which is
Mm.
helps us, feel more chilled, more relaxed, sleep
Yeah.
better. So then you give that person that and they feel horrible on progesterone. But if I don't have any baseline measurements
Hmm.
before I give them that, then I don't know where they
Right.
were before. And now I've given them the stuff that's going to change where they are now. So when I test now, it's not really related to where they were before. So I always like to get a baseline measurement, even though it's challenging.
Yeah.
I like to get that baseline just to kind of give us a something to look back on in case there's a problem.
Right. And then I guess you just kind of go off on how they feel.
Yep. So if they're feeling really well over time, and if they're seeing me and their pain's getting better, and let's say their gut health is improving, and I never work just solely on hormones. We always
Right.
talk about your eating plan,
There's
always.
like a whole,
Absolutely.
there's a
We
lot
don't
going
realize
on.
our gut has a lot to do with our hormone levels in our body as well too. So we really need to focus on our eating plan. So if you're feeling generally well, then we check in at 3 months. We might check in at 6 months and say, okay, is everything going good? If you start kind of to fall backwards, then we at least have that baseline to get retested, see where you're at, and then tweak. Because nobody's system is better forever. It's just like people
Right.
are taking GLP-1s, right? So some people might lose a lot of weight really fast. Some people it takes them going up a couple levels. Some people
Mhm.
they're very it's much slower metabolite. Everybody's different, and it's not a set and forget. It's not a
Yep.
prescribe and forget type thing. It should be, in my opinion, something that's monitored by more than just your symptoms and like regular testing just to
Right.
see where everything's at.
Yeah. So when we, hit a certain age, women of a certain age, do you find that you're um obviously the hormones are fluctuating a lot more and symptoms are popping up and it's more chronic pain, or are we seeing more just like we're just sort of struggling with
Mhm.
being more active? I don't really know, but I just feel like we hit that certain level and our bodies just kind of like,
Mhm.
you know,
Yeah, it's because we don't prepare for that, right? And we're not told to prepare for it. We tend to think, oh, I'm not in menopause yet. I'll worry about that when I get there, right? But then wham, it gets you, and you're like,
yeah,
holy crap, I should have probably done something about this before. And
right,
we can prepare, right? Because those hormone levels decrease and we lose the anti-inflammatory effect of those hormones. So we can prepare by decreasing the inflammation from what we're eating or drinking.
eating,
Alcohol is a big one, right?
right,
When do we tend to drink more wine and more alcohol and become more relaxed as the kids are getting older and we have more time? And that's exactly the time that our hormones are decreasing.
right,
So it's this terrible perfect storm of setting ourselves up for, more pain and problems,
yeah,
right? And then food, right? The ultra processed foods, most people know about now to get rid of those. And then foods that, are better for us. And, we're spoiled as Americans. We kind of just want to eat what we want to eat when we want to eat it. So we do sometimes have to make some sacrifices in order to then feel better down the road. So it is common, but not normal. Like not everybody has to have joint pain when they go through menopause, but
right.
it is common.
It is,
And yeah, and it's actually more common in some cases than hot flashes, which not a lot of people understand or know.
right,
But it is something that a lot of women do experience. And the good thing to know is it's not something you just have to live with, that there's nothing you can do
right,
about it. There's many things that can be done. If the doctor tells you, oh, you're just getting to be that age,
yeah,
or what do you expect? You're XYZ. That's, in my opinion, these days, with the data that we have, is really unacceptable and
yeah,
in the border of even gaslighting, right? So we go, all right, what can I do? What could I focus on to
hmm.
optimize my situation? I will always go back to eating plan first.
Eating plan first.
Hmm.
Okay, so definitely like checking that because that's one of the things I hear a lot as a personal trainer and I'm coaching women and it's like, oh, this hurts, it just must be aging and
Hmm.
oh, it's what you get when you're just my age and
Hmm.
I'm like,
I hear
No.
that all the time. For whatever reason, I have a lot of nurses that come to see me and they're like, oh, I worked 20 years as a nurse and I was, lifting and I'm like, you haven't worked as a nurse for 10 years. This is not the reason why you're having pain right now. But that's how we're conditioned to believe, right? So we're just conditioned to believe that we wear ourselves out, then we get to a
Yeah.
certain age and we can't get any better and all that. And that just fits right into all the industries that make money off of us feeling crappy. So,
Yeah. No,
so it fits that
seriously.
narrative. Hmm.
Yeah, and it's like one of the things, how do you feel about like movement kind of as medicine?
Oh yeah, it's 100%. Like 1000%. Even if you're in pain, if you can
Yeah.
move even a little bit, even if there's a small amount of non-painful range or a type of discomfort that isn't exacerbating your pain, movement, and it's been shown now in studies over and over again, movement will significantly help with pain, but people are afraid to move because they're afraid that they're going to have more pain. That's where they need the guidance.
Right, right. So do you find like the more, because I know for myself, if I am feeling something, once I start moving and
Hmm.
getting more active and getting the body warmed up and getting it heated up, I always feel better.
Hmm. Absolutely.
And
Yep.
it's just getting over that little mental
Hmm.
hurdle of like, do this, it will work, it will
Hmm.
feel better.
Hmm.
I just find that the body's amazing.
Oh, it is. It's way more amazing that any of us, even us, we're more holistic, even give it credit for.
Yeah.
And we're constantly, generally, the population is constantly being told to overtake it, manage it. Your body's doing something wrong. It doesn't know what it's doing. Da, 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 da. And that's so not true. It's the
Right,
exact opposite. So
right.
if we shift that paradigm in our brain to go, my body is really intelligent, and I really need to listen more to it,
Yeah.
versus going, whatever, it's just because I'm 52 or
Right.
those types of things. If we learn more about how our body works, and I think more people are into it. I mean, I'm in the Midwest, right? So when I first started doing this and talking about gut health, people are like, what the heck are you talking about? I want my
Have you
beer and
lost
I
your
want my
mind?
cheese, right? I want my beer and my cheese. But now I would say in the last 5 years, 6 years, if I bring up, now this isn't across the board, but if I bring up your eating plan, if I bring up hormones, I bring up stress, people lean in a little bit more to be like, interesting.
Yeah.
Okay. So they may not buy that story, but they do tend to want more information
Yeah.
about it. There are still people though that, will just refuse to give up something, especially if it's, something they're eating or drinking.
Yeah.
And I said, if I could tell you that that one thing is what's causing you this debilitating pain, would you give it up? And there are some people that say no.
Yeah.
That doesn't register in my brain, because I
Yeah.
don't want to feel terrible. Maybe because I know what it feels like to feel good now, and
Right.
that's where I want to stay. But there is that mindset and this stuckness around food
Yeah.
and patterns around it, that go way deeper than just nutrition, right? Or what
Yeah.
you're
And the
putting
thing is
in your
like I
body.
can understand that sometimes. Like I love chocolate. And if you told me
Hmm.
like chocolate was off the menu, I'd be like,
Hmm.
well, okay, okay. It's gonna hurt for like 3 weeks. But I think like
Hmm.
once you get past that,
Hmm.
your body adapts, your mind
Hmm.
adapts. Like
Hmm.
we are extremely adaptable beings.
Hmm.
And it's
You
just,
stop craving it,
yeah,
right? You
you
just have to
literally
get away
stop
from it.
craving it.
Hmm.
Yeah.
Yeah.
Yeah. So it's like you
Kind of
just,
like breaking up with a bad boyfriend.
yeah.
If
Yeah, it's gonna hurt at first.
yeah, yeah. Stay away from him.
Yep.
And then at least for like a month, focus on other things, doing different
Yeah.
things, getting a
And
new
then
boyfriend or whatever.
and then
And then
it'll
it's
feel,
not as hard.
yeah. It's so true. Yeah, you just have to give yourself that opportunity. And yeah, I could see there's definitely fear around that for
Oh, for
sure.
sure. Yeah, it is very interesting to me. I would love to someday, maybe when I retire, to kind of dig into that and understand those patterns of why, even at our age, like, I'm pushing 60, like why would that still be a pattern? There's got to be some there's got to be some attachment to it in some way. And that's not
Yeah.
a bad thing. It's just, to me, it's very, very interesting. Like if I had the opportunity to be like, okay, no pain ever, just eliminate these three things.
Yeah.
And there's some people that are like, no,
Right.
that just interests me to what's underlying that.
I guess, it's a lot of identity,
Mm,
work, and maybe that's just more of like a behavior that they just,
comfort,
yeah,
right? Right.
yeah, we know
Yeah.
that stuff is
Interesting.
powerful, extremely
Hmm.
powerful.
Right.
No
It
matter how
is.
bad you want to change, it's really hard to do the change because
Mhm.
yeah, we could like dive into that whole thing.
Totally. Yeah. Alcohol's another one too, right? I mean,
Yeah,
there's the physiological aspect of it, and then there's the emotional aspect of
yeah,
it. And there's
yeah,
all sorts of things that it's connected to, like having fun, doing what I want,
yeah.
all the independence type stuff. So yeah, I could go on and chat about this forever.
It's a whole other
Mhm.
podcast
Yeah,
for
right?
sure.
Exactly.
Um, just like leaving off, what would be your one best piece of advice for the woman who is looking to age fiercely?
Gosh, I just love that title. Um, Number one is, and I think this is would be behind aging fiercely, is don't accept those statements of, oh, it's just because of your age, right? Be always looking for a solution. Now, don't, jump into everything that jumps on at 2 a.m. on an infomercial, right?
Right.
Have some discernment, trust and verify. But really to live fiercely is about continuing to, in my opinion, or one aspect of it would be to be continued trying to live the life that you want, right? So if you want to be active, if you want to have, you know, intimacy without pain, if you want to do all these type of things that you feel limited, keep looking for a solution.
Yeah.
And don't be closed off if it's not covered by insurance. Now, again, discernment is because there's a lot of stuff out there that is, probably a waste, but do your due diligence. We have the internet at our fingertips to do
Hmm.
research about
Yeah.
and see if it's right for you. Uh, I would say just don't give up, right? And
Don't
keep
give up.
pursuing what you love.
Yeah. No, I agree. I love that. That's perfect.
Mhm.
And I know you're in Wisconsin.
Yes. Hmm.
How can people work with you? Can anybody work with you? I know states have certain rules and regulations.
Yeah, so I am from a wellness point of view, anybody can really work with me. From a point of view of like functional medicine, under my nursing license, I have a multi-state compact license, so telehealth is an option. From a physical therapy point of view, within my area, people can come and see me, but I can certainly coach other people. So telehealth is an option if you're not local. If you're local to the Milwaukee area or Wisconsin, I have people coming up from Illinois to see us as well.
Wow.
You certainly, our clinic is New You Health and Wellness, NEWYOUAND, Health and Wellness. And they can reach out to us there. If you, I do have a podcast called the Pain Free Formula Podcast. So
Hmm.
we talk about all different things in regards to how to address pain. And we even have some local spotlights. I just did a recording with a local business that also is a farm that, helps with community, and you can get in, a bunch of vegetables and all that type of stuff sent to you like every
Oh,
quarter.
like
You
a
can pick it up.
CSA or something?
Yes, that's it. Yeah, the CSA.
Yeah.
Yep,
Yeah.
exactly. And so there's so many of those things out there that we try to let people know about too. My book, The Pain Free Formula, is on Amazon, and please take that to your more open-minded practitioner. If that practitioner has questions, have them reach out to me.
Right.
I really want my legacy in life to be about helping people live their best life, really.
Yeah. That's amazing. Thank you so much. This has been a great conversation. I
Oh, thank you.
thoroughly
I really
enjoyed
enjoyed it too. Thank
it.
you.